Hi everyone. Thank you again, Dr. Gharipour, for inviting me. I'm very excited about this class. And again, my name is Naomi Sachs, and I'll be talking today about healing and therapeutic landscapes, giving a little bit of background and research and theory and design. So what I do here at Maryland and elsewhere is I do research and education and advocacy as well as some design consulting still for access to nature in healthcare and beyond healthcare as well. And I'm also director here at UMD of the Health and Access to Nature and Design Living Lab. The reason that I became interested, particularly in design for healthcare facilities, is that all too many of them still look like this. And I'm not sure how many of you have been in a healthcare facility, either in this country or in other countries, but this is all too often the site when they could look like this. So they could be more comfortable, have soft, social seating, basking in natural light with an access to a beautiful garden outside. So much more like the lives that we actually live in. And all too many gardens still look like this. This is at a psychiatric hospital in San Francisco, when they could look like this. This is a Boston Children's Hospital in Boston, Massachusetts. So much more supportive of human health and well-being. And in 1999, I founded the Therapeutic Landscapes Network, which is still up and running. And the intention was to create a virtual gathering space and kind of information clearinghouse for people to get research and literature and connect with each other about access to nature, primarily in healthcare facilities. All right, so what is health? You will probably hear or see this definition more than once during this class, but I will start by giving, this is the World Health Organization definition from way back in 1948. Stating that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So in other words, being healthy is not just not being sick. It is a much more holistic definition of health as someone who is thriving and flourishing in their life. And let's talk about some other definitions. So my definition of a landscape for health, or also a restorative landscape, is any outdoor and even sometimes indoor space. So here, this is a cancer care center in Boston, Massachusetts, large or small. So here's a national park, and here's a guy with just a few plants on his fire escape, wild or designed. So again, national park, and designed even this memorial, the Vietnam Veterans Memorial here in DC, that facilitates human health and well-being. So there are many different types of landscapes for health or restorative landscapes that we can look to. Now, I often get the question, well, aren't all landscapes for health? And we unfortunately can see so many examples of outdoor spaces that are not conducive to human health and well-being. Imagine parking in this space here and having to walk to this building, either in the heat of the summer or a cold, rainy, drizzly day in, well, January or February. So a couple more definitions. Healing gardens, many of you probably have heard of healing gardens or therapeutic gardens. These are designed for a specific population, ideally informed by research, and I'll get to that definition of research or evidence-based design, with a specific intended outcome. And that outcome could just be getting outside. It could just be stress reduction. So this garden is designed for children, and you can see how everything is sort of child scale. It's very lush and green. And this garden was designed by David Camp for people with HIV and AIDS. It was very important for them to get outside, get some fresh air, some vitamin D through sunlight. And then a rehabilitation or also a therapeutic garden is even more designed based on evidence and research. And this should be designed with a therapist, like a physical therapist, an occupational therapist, for a specific population or therapeutic modality. So this garden, the Els Garden in, I think it's Gainesville, Florida, was designed with an occupational therapist and physical therapist and landscape architect for people on the autism spectrum and with other sensory processing disorders. And then the garden on the left was designed for burn victims who were just learning how to use a wheelchair or learning to walk again or use a walker. And, you know, unlike in a hospital where all of the floors are flat and smooth, once you get out into the real world again, nothing is flat and smooth. And so this garden was designed very intentionally with different surfaces. And this is a ramp that's made of gravel. Here's grass that people can walk or roll on. There's a lot of shade. These are burn victims, so they're still really recovering from those injuries, and water to give that sense of cooling and restoration. So I mentioned evidence-based design, which comes from evidence-based medicine, which is the use of research to design environments that promote human health and well-being and that improve outcomes. Again, it could just be to restore or to lower stress, but it could also be to facilitate conversation and social connectedness. It could be for walking. This path, which has a very good wayfinding feature, goes in a circle so that someone who maybe is getting out of their wheelchair for the first time and going for a walk, they know, okay, if I go around one time, I will have gone a quarter mile. This garden is also very rich in vegetation, which is one of the most important parts of a healing garden, hence a garden. Many of these points are based on evidence. You can see these are tinted concrete pathways. This glary concrete is really bad for people with aging eyes or people on psychotropic medication. The wooden seating is very comfortable, and it's also easy to get in and out of, having backs and arms, and it's movable. So there's a lot of good evidence that having a sense of choice and control, especially in an environment like a healthcare facility where people are stripped of so much of their control, having that sense of choice and control through movable seating, through choices of where to go, whom to sit with, those are all critically important. So the evidence is clear, and there is a huge amount, over 500 studies of the beneficial effects of nature on our health. Contact with nature, both passive, meaning just being in nature, going for a walk, sitting on a bench, enjoying the sunlight on your face, or active. So as this woman is doing with her occupational therapist, physically gardening, getting your hands into the dirt. So this connection with nature reduces a lot of bad things like stress and depression, anxiety, even aggression and violence, loneliness and pain, and improves a lot of good things like mood and well-being, immune function, incredibly important in healthcare facilities, and also now with still lingering global pandemic, as well as students increasing cognition, productivity, even creativity. And being in nature promotes a lot of good things like exercise and a sense of connectedness with one's community and other people, altruism, and even environmental stewardship. So you will probably also hear about this study. This was kind of the study that kicked off the scientific and the healthcare community really taking notice of the potential for nature to be beneficial to human health and well-being. This study was done by Roger Ulrich and published in Science in 1984. It was a very simple but very elegant quasi-experimental study where Ulrich looked at patient records. These were gallbladder patients who were recovering from surgery at a time when people took between 7 to 10 days to stay in the hospital. Now it's probably like they stay in the hospital one night, but these patients stayed for much longer, and some of them had a view of nature, of some trees and grass, nothing super fancy, and some had a view of a brick wall. What Ulrich found was that the patients with the nature view, they were quote unquote better patients. So they complained less to the nurses. They needed less pain medication, especially for severe pain. And probably most important, they got out of the hospital sooner, almost a full day sooner than those patients who had a view of a brick wall. And you can imagine from an altruistic point of view, this is good. It's good for the patients, it's good for the staff, the healthcare workers, but also from a financial point of view, all of these factors help the healthcare organization financially. And that probably is what really made the healthcare and scientific community take notice. So since then, there's been a lot of research about why is nature therapeutic? What is it about being in nature and spending time in nature, being exposed to nature? What about that is good for our health? And there was a very good literature review done by Ming Kuo in 2015, where she tracked all of these different potential pathways. And what she found, or her final conclusion, was that immune function, and that improved immune function is probably the primary pathway. But she did a really good job of synthesizing the existing literature. And so part of it is just the time that we spend in nature, and that it is a positive multisensory experience. So we're not just hearing bird song and that's making us feel good. We're also feeling the breeze, and we're smelling beautiful smells like the mulch in a forest, or the greenery, or the pine scent. And we're also seeing beautiful things like butterflies and greenery and flowers. And all of that is lifting our mood and lowering our stress rate. There are also some active ingredients in natural environments that even if we're not necessarily enjoying being outside, those active ingredients can contribute to our health. So for example, air quality. Air quality, when we are in healthy natural spaces, is much better. And there's more and more research that plants create oxygen and gobble up carbon dioxide. They cool the air, they reduce the heat island effect. So it's not just about aesthetics. In water, and you'll probably learn about blue spaces, or spaces that are near water, water has a lot of negative ions, and plants, since they do evapotranspiration, they also have negative ions. So negative ions are positive. They're good for us. They stimulate serotonin and dopamine, which are those happy hormones that counteract a lot of the negative stress that we experience. So some theoretical foundations, or the one that's most important, is biophilia. And this was coined by Erich Fromm, but was really popularized by E.O. Wilson, the biologist, in 1984. And it's this idea that we have this instinctive, innate bond with nature and other natural organisms. And this is a picture of Richard Louv, who wrote Last Child in the Woods, with his dog when he was a child. So there's this innate sense of connection with other life and living things. And if you think about it, perhaps on an evolutionary level, we know that we need water to survive, we need plants to survive, we need other creatures to survive, as well as other people. So it's not surprising, but his coining of that term was very important. Also, there is attention restoration theory and stress reduction theory. my reason for choosing healthcare, I'm not creeped out by healthcare facilities like many people are. And I felt like healthcare gardens are, and healthcare facilities in general, are places where people are at their very most vulnerable. And so I thought, well, this is something where I could do a lot of good by studying and helping to improve the design of healthcare facilities. And I thought, well, almost everyone in their life will encounter a healthcare facility at some point. So I'll be able to reach all of these different people through designing better spaces. That thinking has evolved for me and in the profession as well. Um, that we really shouldn't have to wait until people need a hospital in order to think about and design for their health. And so you may have heard this term salutogenic design, which is design for health. It's almost like preventive care for design. So it's like the public health version of design. Salutogenesis, salus meaning health, and genesis meaning the beginning of. So it's about health promotion. And if, as you see from this architectural photograph, there are several examples in this one photograph of salutogenic design. First of all, beautiful staircase. Why would you take the elevator if you can walk up these stairs, have natural light all around you, have greenery climbing up the stairs and cleaning your environment and making you feel good because you have contact with nature. And then also note these little nodes at every kind of landing in the stairs. These facilitate connection with people. So this is a really wonderful example of salutogenic design, which means that we're getting away from that pathogenic or biomedical model where you're only looking at what is wrong with someone and how do we make a sick person better? How do we fix what is broken? This is a, sorry about that, somewhat blurry picture of Mount Sinai Hospital. You can see there are no windows on this side at all. While it is still absolutely essential to fix people and help them heal, we shouldn't have to wait until people are already broken or already have heart disease or diabetes. We should work more and more on salutogenic design so that they never have to go to a hospital in the first place. Or maybe they just go to a hospital to give birth or be by the side of someone who's giving birth in a much more joyous occasion. With that, when we think as designers about designing for vulnerable people, especially people in healthcare or perhaps in prisons, or even in more disadvantaged neighborhoods, we have to take almost a doctor's Hippocratic oath, or a healthcare provider's Hippocratic oath of to do no harm. So in all of these three outdoor environments, they're beautiful. However, if you were designing a path for frail elderly at a, let's say at a nursing home, this pathway probably would not be the best choice because it's a real fall hazard. This digitalis or foxglove is a beautiful plant and has interesting medicinal properties, but it's also extremely toxic. So you would not want to put this in a garden for someone with dementia or a child who puts everything in their mouth. And then this garden, this beautiful koi pond, is, you know, very nice, has water and it's very soothing. But again, for a child or someone who is at risk of falling, having this open body of water might not be such a good idea. As we know more and more, especially from COVID, became very clear that people are vulnerable outside of healthcare facilities too. And that depending on where we live and our zip code, access to green space, open space really varies. Whether people have access to green space at all, natural environments, and the quality of those environments, that really varies depending on one's zip code, one's race, one's socioeconomic status. And so as designers, it's critically important that we pay attention to that and we try to design to ameliorate those differences or get rid of those differences. So some of the other research that I've been involved with is looking, for example, at the potential for green space to reduce violent crime. And there is some really interesting research that we found in our systematic literature review, and also in our subsequent meta-analysis, that green space, depending on how it's designed and maintained, does have the potential to reduce violent crime in urban settings. But it has to be done well. It's not just kind of a blanket salvo. I would encourage you as designers and students and scholars to think about going beyond that Hippocratic oath. Here in Maryland, we have the Do Good campaign and at University of Maryland. And so rather than just not doing harm, think about how can I do the most good in the world. Thank you very much, and I welcome your questions and comments.
I'm curious how easy it is to retrofit existing buildings to be more of a healing space. Like, I look at these photos of the really pretty hospitals and they look brand new. And it kind of looks like a place where someone who maybe is low income or is on Medicaid or Medicare wouldn't have access to, because typically those clinics are a little bit older or not as high quality. And so I'm wondering if you could share like any examples of maybe a clinic or a hospital that didn't have really beautiful architecture initially, but they were able to almost like work with what they had to make it a healing space, or if there's kind of like a methodology for that.
Yeah, that's a great question. And that is absolutely true. That there, I mean, we have a lot of old buildings, and so there's a lot of talk about, how do you retrofit? One of the easiest ways is to put up pictures. So there's a lot of good literature on the power of even access to pictures of nature and views to nature from indoors, but even just a picture can reduce stress, can improve human health and well-being. And so if nothing else, a healthcare facility or a school or a prison or even a person in their dorm room, they can put up a picture of nature, and perhaps it's something meaningful, like an example of placemaking. Perhaps it's a picture of a body of water that's nearby that's very special in people's hearts. Or if it's, Colette, you personally, you might have a landscape that is particularly meaningful to you, and having that picture might be more effective, let's say, than just like a random picture of a flowering tree. So that is one way. Another is to bring the outdoors in. So this is a little tricky in healthcare facilities because of infection control. But there are many facilities that can have indoor plants through either potted plants or green walls, living walls, occasionally even fake plants. So I read a research study, this was a few years ago, but they asked cancer patients in a clinic whether they would like to have either real plants, fake plants, or no plants at all. And the patients said they would rather have real plants, but if it was a choice between fake plants and no plants at all, then they would like to have at least fake plants. So at least a semblance of greenery and life. They just said, just dust them. So make sure that, they're in good condition, so that they, have that effect. So those are some things. Bringing in natural light, or often perhaps it's a policy decision of, maybe the blinds are broken or they're just kind of automatically always closed, and there's a policy decision when people are aware that natural light is important, or maybe there's a beautiful view outside, or interesting, maybe there's a flowering tree, but it's just sort of habit to always close the blinds or the curtains. Open the blinds, let some natural light in. let people take advantage of those views. So there are absolutely things that one can do, even if it's not a brand new fancy building.
Thank you.
You're welcome.
Do you feel that designers should first test their designs before implementing them? Because you could implement a landscape and realize that it doesn't work, or that it doesn't have a really significant impact. And also, like, what are those measurements that should be studied? Because Ulrich was looking at like patient recovery, but you can't do that for everybody because not everyone is recovering from surgery. So I think I'll leave it at those because those are some pretty big questions.
Yeah, those are really good questions. And unfortunately, we can't always test our designs, partly because there is limited funding, partly because getting into, and if we're just talking for now about healthcare facilities, getting into a healthcare facility afterwards, especially if you're doing real research, then you need to get institutional review board approval, and it's all rather, time consuming and takes a bigger budget than many firms or even academics sometimes have. So that's why doing the evidence-based design is so important, and looking at precedents and case studies and saying, okay, well, it worked for another cancer care facility in another similar environment, and we're a cancer care facility, and so we're going to, follow the best practices and the evidence to make this work. Now, for what you're asking is a post-occupancy evaluation. So there are post-occupancy or POEs that are done. People also sometimes, in best case scenario, they do a pre-OE, so a pre-occupancy evaluation to find out what's working, what's not working. Then they do the design, and then they do a POE about a year or two later to find out, okay, what were our design strategies and did they work? What went wrong? What went right? What could we do more of? Sometimes those POEs actually turn the healthcare facility pays attention and makes changes based on the results of the POE. So for my dissertation, when I got my PhD, I actually designed a POE that's the healthcare garden evaluation toolkit. And it's a set of 4 measurement instruments that you would go in and do specifically for gardens in healthcare facilities. So hopefully that answers some of your questions.
I think, yeah, no, I think so. And I wanted to ask another follow-up question. This one I think is very pertinent to the architecture and construction. And that is that would ultimately policymakers and financiers have a play an important role in getting a building built. And so I see the potential issues of like case studies and precedents being sufficient for policymakers and financiers to actually want to pay for these landscapes. And so the reason I was asking like what measurements, I do a little bit of research with a professor there at Maryland, studies like physiology and looking at different environments and through VR or pictures. So I wonder, what that's going to look like going forward.
Yes, that is why empirical research is so important. And that's why Roger Ulrich's study way back in 1984, which is still cited today, not just by me, was so important because it really showed hard evidence. I love qualitative research and I think it's incredibly important. But as you point out, the policymakers, the healthcare providers, they prefer quantitative evidence. And so having clear numbers about these, this population got out of the hospital sooner, or they were more satisfied. And there's some really good literature on satisfaction with the healthcare facility and, likelihood of recommending to your friends and family. Now, fortunately, even before the pandemic, but especially afterwards, people are actually thinking about the caregivers as well. So the healthcare staff, nurses, and doctors. It's incredibly stressful. There's a huge burnout rate, and that costs a facility a lot of money. And of course, it's bad for patients and visitors too when healthcare staff are not performing at their highest, or they're quitting, or they're not signing up for a job. And so having evidence that when people go outside and connect with nature, that lowers their stress level, that helps their concentration and actually reduces medical errors, that attracts them to a facility or helps them to avoid staff turnover. Those are all really important metrics. And we do see some of those, but we absolutely need more.
So my question is, can this landscape features can be integrated with the community, so it kind of serve as a double purpose? So, like for example, I wouldn't like to wait until I get sick to take advantage of these beautiful spaces. And looking from the other side, I believe that a lot of people who take therapy also interested in integrated with the community, and just naturally seeing other people who are not sick around them, and just feeling more normal inside of this. So, or maybe the kids also coming to the garden that's designed for elderly people, but I personally know that elderly people love seeing kids playing around. So is there any study or any case studies that obviously I know that there's probably a lot of restrictions of what can be done, but in few examples I've seen that there's like a brick walls that's been just like boxed out, or a courtyard, for example, it's not really welcoming for outsider because it's just inside the building and it's pretty isolated. So you can give me a little bit of information about like if there's any studies about this or any study you had done, that would be lovely.
Yeah, that's such a good question. I'm really glad that you asked that. So healthcare facilities in general in the past 100 years or so, at least in this country, they've been separate, as you say. There's just they're kind of this like ivory tower, another ivory tower in addition to academia. And, you go in when you're sick and that's about it. And even though they're often in a community, they're not really a part of that community. And in the last decade or so, there's been a big push. I think it was started really with Kaiser Permanente in California and has sort of rippled out from there to a shift in mentality with these healthcare organizations, realizing, if we want to do patient-centered care, where we're looking and taking care of not just the doctors, but also the patients. And then we want family-centered care. Well, then we should really be thinking about community-centered care. And so, how do we benefit and how can we reach the community? One of the earliest ways that Kaiser Permanente did this was by offering farmers markets at their facility right outside of their doors. And those have become popular in many other states and healthcare facilities around the country. Other facilities have, they might, if it's a new facility, they might find a park or a beautiful natural space and build right next to that so that they can integrate with the community and then also allow people or encourage people to go to the park. Or maybe someone's visiting the park, but then they could actually go to the facility to have lunch. Imagine that. Someone's just like, oh, they have really good food and it's healthy. I'm going to go to the hospital for lunch. That actually happens in some places. It's also, these healthcare facilities, even though they're providing health care, they don't have great reputations as places of health and encouraging health. And so that we have seen more of a change again in the past 5 or 10 years, where they're trying to integrate with community, to plant trees, to have stormwater management mitigation, rain gardens, and other ways of really showing up front and integrating this idea of health. That's a great question.
Okay, thank you very much. Thank you very much for your presentation. Quite interesting. I was captivated by it. I have two questions and one is just a comment. Now, I'm interested in the Therapeutic Landscapes Network that
Yes.
you co-founded. I'm just wondering, what is your 20-year plan, or what is your future plan? But in case you achieve all these things that you're trying to achieve, what next, eh?
Ah,
No, the other one is, have you worked outside the US? Have you worked outside the US in areas where some of these things are not taken at I don't know what to call it, whether I'd call it face value, but have you worked in places whereby, for example, in Uganda, if somebody has maybe autism or a disease that they're not familiar with, part of the society can ascribe that to either witchcraft, or they don't claim you're sick, or they even claim it's a white person's disease,
mm,
you know. And how do you handle such situations? That's if you've worked with such situations. Then the comment is on the research by Ulrich in 1984, which I just want to add that it just reminded me of a pattern language by Christopher Alexander,
yeah.
talking about corridors as a dead spaces. And I noticed you actually put a corridor there and say, okay, instead of doing a corridor, you do this other space that is having all these connections to the natural or the outdoors or gardens, etc., etc. So I guess looking at a pattern language would also, I guess help in that regard. Thank you.
Oh, thank you. Those are great questions. And yeah, I love Christopher Alexander and pattern language. So that's a really interesting comparison that I hadn't thought about before. The Therapeutic Landscapes Network is, I think, right now it's sort of ticking along because of being on the tenure track. I don't have as much time for it as I used to. So mostly right now there is the database of providers and therapeutic gardens. There's an extensive list of literature, and we try to keep that updated. And then there's a lot of activity on social media where I and others share information and questions with each other. So that's the TLN. So I would love to work more in other countries than I have. I have not worked anywhere in Africa, and I would love to in any of the many, many states or countries, I should say, in Africa. I did some consulting work in Peru, and that was really interesting. That was for a clinic, very, very remote clinic, where people were being treated for, anything from tooth infection to pregnancy to, a life-threatening disease. And in some countries, in the United States, there is more of a disassociation between nature and the physical environment. And so in Peru, for example, people were much closer to nature already, and it wasn't as much of a hard sell. This is true in Hawaii, in this country as well, where just the outdoors and the indoors are already it's very porous. And so, it was sort of almost taken for granted that people would want access to nature and the outdoors to be in that clinic. Other good examples, there's so many good examples of healthcare facilities in other countries. I'm thinking of Kutek Puat Hospital in Singapore, which calls itself the garden in a hospital and a hospital in a garden. I've never visited there, but it's definitely on my bucket list of a place to visit and perhaps even do research in.
Yeah, first off, thank you for the presentation. I'll try and sum my questions down to one. We sort of already lightly talked about how we can sort of bring nature into buildings and sort of start to work with and neighborhoods or environments that are sort of already densely packaged. So getting down to, I guess, a more specific question in regards to sort of some of our school projects here in the School of Architecture. My question is, how can we use different or alternative greenery landscapes to help promote like healthier environments or more socially healthy environments? And I'm specifically asking in regards to something in regards to maybe like cemeteries being used as sort of an alternate green space that can be used for these, because for some of our cities or sites for our projects, they are very like densely packaged or during environments that are sort of were mostly industrial. And so the only real greenery or sort of amenity in that regards would be something like a cemetery or something that's not traditionally seen as like a green, healthy, typical aspect. So I wanted to get your thoughts on how we can potentially sort of reshape the idea of having these spaces that aren't seen as sort of like healthy promoting spaces and sort of try to change the attitude towards them.
Yeah, that's a really interesting point. And cemeteries, especially these green, almost pastoral landscape cemeteries, they were in the turn of not this past century, but the one before, at the 1800s to 1900s. Those in cities were some of the only large pieces of green space in cities. And so Mount Auburn Cemetery in Boston, Massachusetts is a wonderful example where people used to go picnic in the cemetery because that was the only green space where they could picnic. And Frederick Law Olmsted, who's often considered the father of landscape architecture, he recognized this and he said, look, it's all well and good to go have a picnic on someone's grave, but maybe we actually need a large park in, let's say, New York City, what became Central Park, where people can go and frolic and bask in the sun and play and get exercise. And he really saw these green outdoor spaces as democratic spaces. It didn't matter what socioeconomic status you had, or whether you had a job, or what color you were, or what country you were from, you could go to these public spaces. And so I think that's still incredibly important. And I did mention that, these spaces are not created equal. And so part of it is having policymakers, people in the government, people in positions of authority, recognizing that people need access to green space and good, safe, healthy access to good, safe, beautiful green space. And whether that's more trees on the street that reduce the heat island effect and provide beauty and shade and habitat and reduce stormwater surges, or whether it's creating a green schoolyard so that children who, when they go outside for recess, they're not just on an asphalt playground, but they're on a more nature-rich playground. There are a lot of ways to, either in small ways or large ways, infuse nature into more urban environments. But it takes us, the people, to make the case and to present the research, but it also takes the decision makers and the ones who have the money in their pockets to, make those positive decisions.
In your presentation, you mentioned the stress reduction theory.
Mm-hmm.
Do you think you can explain a little bit more about the theory?
So this was posited again by Roger Ulrich a little bit later on, that when we reduce stress, we improve people's health. Stress in and of itself is really bad for us. And there's a lot of evidence on how deleterious stress is, but it also exacerbates just about every other health condition. So someone with diabetes, if they're more stressed, then they have more symptoms. Someone who has ADHD, When they have stress, then those symptoms increase. And so stress reduction theory is that the physical environment has the potential to either increase our stress or lower our stress. And what we ultimately want is it to lower our stress by, and he talked about these elements. So providing safety and a sense of security, providing a sense of choice and control. And, in general, the less sense of choice and control you have, the more stressed you are, and the more something like, having at least a sense of, or an even actual choice and control is going to be important. Social connection, being able to connect with other people, or at least other organisms, animals, creatures, birds, having that social connection is incredibly important. And then for nature specifically, nature can provide the opportunity for physical movement and exercise, and also positive distraction. So there are other types of positive distraction that we can imagine, like, I don't know, playing a video game or watching a funny movie. But nature is a really good form of positive distraction. Which is, and I will unhide this slide. Actually, I don't have to unhide it, I'll just show it. So Stephen and Rachel Kaplan posited the attention restoration theory, which is this idea that when we're really focused on something, we use directed attention, whether that's we're working on our homework, or we're driving, or we're walking in a really busy urban area and trying not to get walked into by someone who's on their phone. That's stressful, and that depletes our attention, that depletes our batteries. Being in nature, and either passively or actively, is one of the best ways to restore our attention. And they call this soft fascination. So if you imagine just sort of being on a bench and feeling the breeze on your face, and then this butterfly comes lilting by, or you hear the bird song, you're paying attention, but you're not focused. And there's something about that soft fascination that really recharges our batteries and allows us to go back to that task. So for some reason, Ulrich and the Kaplans thought of themselves in competition. But I really see these theories as reinforcing each other, as ways that access to nature, provides this attention restoration and also stress reduction. You could think of one as being a little bit more cognitive and one being more physiological.
How much research has been done on the impact of specific plants on specific diseases? Like, for example, let's say, what kind of plant or flowers we should have in a healing garden designed for cancer patients, or a specific kind of, pancreatic cancer, or, are we advanced in that sense?
Well, yes and no. So there hasn't been a whole lot of that specific, broad brushstrokes, no poisonous plants, or other plants that can do harm, especially for gardens, for people, or children, or people who are developmentally disabled, where, they might grab hold of something, a rose with a lot of thorns, or something that's poisonous. So no toxic or harmful plants. You mentioned cancer care, and that's interesting because we know that for people undergoing chemotherapy, a lot of the side effects for chemotherapy, they cause extreme nausea. And so people who might usually love the smell of roses, or the smell of, a hot cup of coffee in the morning, it will make them feel extremely nauseated, even a scent that they usually like. And so unlike most gardens and healthcare facilities where we encourage, plants that smell good and other sort of good sensory stimulation, in a cancer care facility, you don't want anything. You want to really reduce those smells. There has been some research on vegetation, for example, in desert environments, whether, these sort of gray-green spiky plants are as restorative to people as, your more typical traditional, East Coast, what you would see at the University of Maryland, lush green, and that has been mixed. So I don't have a conclusive answer. But I think, yeah, more specific, like what someone needs if they're recovering from surgery versus if they have, I don't know, on the autism spectrum versus if they have, gallbladder disease. We don't quite know that yet.
And how about Alzheimer's? Are there any studies kind of proving specific plants kind of not necessarily prevent, but kind of slow the progress of Alzheimer's?
Yeah, that is a good point. So a couple things. One, and I'm not sure about slowing the progress of Alzheimer's, but in general, for older people, plants that remind them of happier times. And scent is the most the best trigger of memory, of all of our senses. Scent, smelling something, whether it's good or bad, is a really strong memory trigger. And so if someone had roses in their childhood home or when they were growing up, and they're now in a dementia care facility, then smelling a rose or a lilac or something else that's really fragrant can really trigger and kind of bring them back to that positive memory. The other research that we know about is that people with elderly people who have cataracts and, with aging eyes or glaucoma, especially cataracts, they kind of create this color haze. And so colors that younger people might perceive as like pale blue or pink, those look gray once people have cataracts and their eyes start to age. And so providing plants that are really bright and colorful, like on the reds or the greens, really or the oranges and yellows, those tend to be more effective for people with older eyes. There are definitely healthcare facilities and lots of other examples of indoor spaces where there is that more permeable, at least visually permeable, difference between the inside and the outside. Actually, I think in the architecture building, there's a very small example of this where the paving that's inside extends to the outside. And so you have this kind of seamless connection between inside and outside. Very small example. And wouldn't it be nice if like that big courtyard that's down on the lower level, if that were more beautifully designed so that it would really invite you to be out there and reduce all of the stress and sleep deprivation and other things that architecture and other students struggle with. But yeah, I think that is back to Colette's original question about designing for buildings when they're retrofitting. That is harder to do. But again, it really comes down to this paying attention to the research and the knowledge that people need nature in as many different ways as possible. But we also, in general, tend to spend time indoors, and we have better Wi-Fi there, and there's less glare, and we don't get snowed on. It's cooler when we have air conditioning. So how to bring nature and bring the outdoors in, or let us feel connected as much as possible to that when we're inside, I think is, the more that we can do that, the better.
Naomi, I want to thank you on behalf of the whole class for joining us. It was a fabulous lecture.